we be recording.
Yay, my little scooch.
Let's show up the information.
Oh, it's like on a sled.
1, 2.
We're here.
Hello.
So much people. Sweet. Alright.
No, nobody kicked the table.
Right as you said.
I can't even cut that out. Can I cut that little piece out? No, I can't.
No.
Whatever. This was fun. Alright. Okay. Alright, let's do this. Alright, so how many of you guys hate going to the doctor? Period. Dentist, doctor, whatever. Yeah, me too. So many of my family members, along with like tons of other people, think to some degree that they can treat themselves for certain things. That's not always the case. Like, say you have like, I don't know, a giant open wound on your leg, like, unless you have like proper medical training, there's no way you can like stitch that up and for yourself. I'm not saying go to the doctor for like every little thing that goes wrong, because we all know those people that are like, ooh, I have a sore throat, let me just go to the doctor, you know, or like, I have a slight cough, let's go to the doctor. Like, we all know those people. I'm just suggesting that if you feel something is like truly wrong, like you have like a really weird pain or like something, I don't know, maybe even a cough could turn into something, I'm not sure. But like, don't choose to try and treat yourself. Like, if you think it's absolutely necessary, like, go to the doctor. Whatever it is could like possibly lead to something more serious in the long run. And just so you guys know like exactly what I'm talking about, I have like a couple examples. One of them is a personal example. About 4 summers ago, this happened. I was in a tubing accident up at camp. They went through like the whole protocol, backboard, ambulance, hospital, whatever. And the doctor told me either I can't remember if he said sprained or strained, whichever one is worse. I can't remember which one he said. But basically I sprained or strained something in my neck. I don't remember the exact medical term, but it was like a muscle back here, something like that. They suggested treatment with muscle relaxers and a few weeks of physical therapy. I did the medication, I took the muscle relaxers, which worked very well. But I skipped out in the physical therapy because I was like, oh, I can just like stretch my neck a little bit, you know, do a little bit of this and I'll be fine. I just think I didn't need it. There was no need to spend money on a physical therapist. That's like, physical therapy is really expensive. And there's no reason to spend money on a physical therapist if I didn't really need it. That was my thought process. Long story short, when I went to PT about 3 years later, this was last year, because my neck pain was getting out of control, I was told that my neck was permanently damaged, my complete range of motion in my neck would never be the same, and because of all of this, one side of me is always more tense than the other. You can't really see it now, but like, if I stand straight up, like this side's always like a little bit higher like this, because I'm out of line in my neck area. So Ansley also shared a story with me about her brother. He had a pain in his foot for about 6 months and thought nothing of it until the soccer season started. And when he wasn't able to play on it, he decided to go to the doctor. And on that visit, he was told that he had a rare malignant tumor in his foot that needed immediate surgery. And he almost lost his entire leg because he waited too long to be seen. And he still may need it at the moment, but they said they were able to contain it for the time being. Those are like really extreme examples of what I'm talking about. A more minor one is my dad is the most stubborn person I have ever met in my entire life. And he always refuses every little thing. He refuses to go to the doctor. It could be something, his leg could be severed off, and he's like, I don't need to go to the doctor, whatever. He says he's hardcore, whatever. He caught this really bad cough this past spring, and thought he was like, it's just an allergy thing. I'll just take some like Robitussin or something, or NyQuil, and it'll go away. It'll be fine. My stepmom told me like, she was like, you know what, you need to go to the doctor. This cough, it's been like a month. You need to go to the doctor. It's not getting better. And he ended up having bronchitis and pneumonia at the same time. So all of these are examples of like a portion of things that can go wrong with delayed care. There was a study done in Lima, Peru by A. Valerie, and they were aiming to explore patients' perspectives around their barriers or delays associated with diagnosis of tuberculosis in particular. They focused mainly on the reasons these people gave for not seeking proper care in a timely fashion. In the results, they found that patient-related self-reported delays from their studied population showed variable duration of waiting, spanning from like a week to over a year of waiting to get this proper treatment that they needed. The core reasons for this were patient confusion about symptoms or lack of knowledge about TB, self-medication, work-related conflicts including loss of time to be treated at a clinic, financial difficulties, and fear or embarrassment of whatever disease that they had. There was another study done by Jennifer M. Tabor in the US, I'm not quite sure where it was. It showed similar results to the Peru study. They identified 3 main reasons for people not visiting the doctor when they should. One was low perceived need to seek medical care, which basically is people being stubborn, not wanting to go. Traditional barriers to medical care, which would be an example of like a third world country where it's super far to travel to get proper care. And unfavorable evaluations of seeking medical care. So it's like a doctor or a certain practice of people that are not super good at getting their care done. The first point in layman terms was, like I said before, people just simply feel like they didn't need to go. They believed that it would improve over time and they could fix it on their own. Many participants stated that they avoid medical care because they aren't sick. There's no need to fix something that's not true, that's not broken. AKA stubborn people. For the second point, this refers to people in other countries that don't have the same materials that we have here in the U.S. They have too little time or too much to do to take a trip somewhere that's super far to seek the care that they need. I saw this firsthand. I went on a mission trip in Brazil this past spring break, and there was an older woman. She had to be at least like 85, 86. And she had tuberculosis, and she thought her son had died the year before, and she thought it was just like symptoms of like losing a loved one or like something that built up over time because of a weak immune system. And when we saw her in Brazil, the doctor diagnosed her with tuberculosis, and it was too far gone to do any treatment or anything. It was about a day's boat ride to the nearest town that was semi-equipped for this kind of care for her, and it would have been super expensive to go to that doctor, to take that trip, and do all of that. So that's like a pretty prime example of like the traditional barriers that people in other countries face when needing medical care. One of the primary reasons people don't go to the doctor is because they don't know enough about the certain risky health problems that they need to know in order to treat themselves. There's a super simple solution for this. It's just increasing public health information and inform people about like even like basic hygiene. Like when we went to Brazil, we did this health fair. We just talked about like how to brush their teeth, being outside in the sun to get their vitamin D, and determining hydration based on the color of their urine, which was super important in those areas because hydration is a huge problem in third world countries like that. I'm not saying we need to give lessons to people about proper hygiene, although we all know some people who could need some information about that. I'm saying we could like inform the public about common diseases or things that could need this treatment. Christopher Harrell, along with other colleagues, wrote an article about the effectiveness of school-based intervention to increase health knowledge of cardiovascular disease risk factors in Mississippi middle school children. They spent 16 weeks assessing the knowledge of these children and measuring their height, weight, BMI, blood glucose, etc. They found that they were extremely effective in giving this information compared with the control of the school. They brought in different health professionals to teach students about lifestyles and actually measuring like the individual students' risks for this disease to put it in better perspective that they would understand. Trying to raise health awareness has been a huge part of our society for a long time. The American Public Health Association has given 5 simple solutions for their own to accomplish this. One is engage in social media. Everyone goes on social media now. We see ads pop up all the time. The internet itself is like a pool of stuff that you can inform yourself with. The second one is to create a scavenger hunt. This one I wasn't 100% sure about, but it's more involved. It gets like people involved in the community. They suggested a community-wide scavenger hunt that'll start in like a local park, and as you go down through the town or the city or whatever, you do different exercise challenges. And they give you information based on the exercise challenge that you're at. The third one is to host a screening event, which is having different screening opportunities for things like diabetes, cholesterol, weight, or general wellness at your local pharmacy so you can be more aware of certain things that you may be at risk for. The fourth one is incentivized education. If someone is coming to pick up a prescription, you could ask them like, hey, do you have a few minutes to learn about this certain disease that could be associated with the medication that you're being given? The fifth one is organize a fitness challenge. During National Public Health Week, you could host a week-long fitness challenge in measuring things like calories burned, pounds shed, blood oxygen levels, things like that. The last simple solution, personally, is to just force your loved ones to go to the doctor if you deem it necessary. I found, especially with my dad, that telling him how concerned I am about problems that he's having or whatever, that he'll most likely go if I tell him that he should. Stubbornness can be a huge factor to not visiting the doctor when necessary, but there are tons of other factors, as I previously stated. The biggest ones being lack of knowledge, financial difficulties, and traditional barriers. So I urge you to stay informed about different common illnesses, diseases, and injuries. Also, please make your stubborn loved ones go to the doctor instead of self-treatment. That's my speech.